Did you know your body might warn you about a stroke days or even weeks in advance? Stroke is a leading cause of death and long-term disability worldwide, but many people remain unaware of the subtle signs that can appear beforehand. These warning signals can be easy to overlook, but recognizing them could save your life. A stroke occurs when blood flow to the brain is disrupted, starving it of oxygen and nutrients. This can happen suddenly, but the body often sends signals long before the actual event. Sign 1: sudden and intense headache. A sudden severe headache is a classic warning sign of a potential stroke, especially a hemorrhagic stroke, which involves bleeding in the brain. People often describe this headache as the worst pain they've ever felt, appearing out of nowhere and intensifying rapidly. Why this happens? Bleeding in the brain increases pressure, leading to excruciating pain. In ischemic strokes caused by blockages, a lack of oxygen can also trigger sharp, localized pain. What you can do: seek immediate medical attention if you experience a headache this severe, especially if it's accompanied by nausea, vomiting, or confusion. Don't dismiss it as a migraine or tension headache if it feels unusually intense or sudden. Sign 2: numbness or weakness in the extremities. Feeling sudden numbness or weakness, particularly on one side of the body, is a hallmark stroke symptom. This sensation often affects the arm, leg, or face and can come and go, making it easy to dismiss. What causes this? Reduced blood flow to certain parts of the brain affects the nerves that control sensation and movement. It's often linked to transient ischemic attacks, also known as mini-strokes, which temporarily block blood flow. Action steps: if you notice persistent or recurring numbness, call a doctor immediately. Remember the acronym FAST: face drooping, arm weakness, speech difficulty, time to call emergency services. Sign 3: vision problems. Experiencing blurred vision, double vision, or even temporary vision loss can indicate reduced blood flow to the brain or the eye. This is one of the less obvious stroke warning signs, but just as critical. What it means: blood clots or narrowed arteries can reduce oxygen supply to the optic nerve or the visual processing areas of the brain. Sudden vision changes, even if brief, should not be ignored. What to do: schedule an eye exam or consult a healthcare provider if you notice unexplained visual disturbances. Keep track of any accompanying symptoms, such as dizziness or headaches. Sign 4: persistent fatigue. Unusual persistent fatigue or extreme tiredness can signal that your body is struggling with reduced blood flow. Unlike normal tiredness, this type of fatigue doesn't improve with rest or sleep. Why fatigue occurs: narrowed arteries or small clots can partially block blood flow to the brain, causing reduced oxygen supply and energy levels. Fatigue might also be a sign of an impending transient ischemic attack, a temporary blockage often referred to as a warning stroke. Prevention and action: if you're experiencing unexplained fatigue, consult a doctor and check for underlying conditions like high blood pressure or anemia. Maintain a healthy lifestyle with a balanced diet and regular exercise to support cardiovascular health. Sign 5: speech problems. Sudden slurring, difficulty finding words, or losing the ability to speak clearly are serious indicators of a potential stroke. This can happen without warning and may last from a few minutes to several hours. The cause: stroke-related damage to the brain's speech centers disrupts communication abilities. Aphasia, or difficulty understanding or producing language, is a common symptom in these cases. What to do: if someone is struggling to speak, ask them to repeat a simple sentence like, "The sky is blue." If they can't, call emergency services immediately. Sign 6: neurological symptoms like memory loss and dizziness. Subtle neurological changes like difficulty remembering things, losing balance, or feeling dizzy can be early indicators of a stroke. These symptoms are often brushed off as stress or fatigue, but may signal a more serious issue. What happens? Reduced blood flow impacts areas of the brain responsible for memory and coordination. Strokes can mimic other conditions like vertigo or anxiety, making diagnosis tricky. How to respond: pay attention to how long the symptoms last. If they persist or worsen, seek immediate medical care. Keep track of any other accompanying symptoms, such as numbness or vision changes. Sign 7: high blood pressure. While this is not a symptom you'll feel directly, persistently high blood pressure is a silent yet significant risk factor for strokes. Regularly checking your blood pressure can reveal whether you're at risk. How it contributes to stroke: chronic high blood pressure weakens arteries, making them prone to rupture or blockage. It increases the workload on your heart and reduces the efficiency of blood flow to the brain. Sign 8, sudden and intense headache. A headache can sometimes feel ordinary, but when it's sudden, severe, and unlike anything you've experienced before, it could be a sign of a hemorrhagic stroke. People often describe this pain as explosive or thunderclap-like, and it demands immediate attention. Hemorrhagic strokes occur when a blood vessel in the brain bursts, leading to pressure buildup and severe pain. These headaches can also accompany nausea, vomiting, or even seizures, signaling serious brain trauma. If you experience such a headache, especially if it's accompanied by other symptoms like dizziness or confusion, don't delay. Call emergency services immediately. Avoid self-medicating with painkillers. They won't address the underlying cause and could complicate the situation. Having difficulty forming sentences or slurred speech is one of the hallmark symptoms of a stroke. This condition, known as aphasia, can range from mild difficulty in finding words to complete inability to speak or understand language. Why it's critical. Stroke-related damage in the brain's left hemisphere often impacts the language center, disrupting normal speech. Temporary speech problems may indicate a transient ischemic attack, which is a precursor to a full-blown stroke. Immediate actions. If you or someone around you struggles to speak, ask them simple questions like their name or what day it is. Difficulty answering could signal an emergency. Always treat speech problems as an urgent situation and seek medical care without delay. Sign 10. Numbness or weakness in the extremities. Imagine waking up and feeling like your arm or leg is asleep, but the sensation doesn't go away. Sudden numbness, especially on one side of the body, is a clear indicator of a stroke. Underlying cause. A lack of blood flow to the brain affects nerve signals, causing numbness or weakness on the affected side. This symptom may also cause drooping on one side of the face, making it difficult to smile evenly. What to watch for. Raise both arms. If one drifts downward involuntarily, it's a warning sign. Even if the numbness resolves quickly, consult a doctor. It could indicate a mini-stroke. Sign 11. Vision problems. Changes in vision, such as blurred or double vision, can occur when a stroke affects the brain's visual processing centers. This may include sudden loss of vision in one or both eyes or difficulty focusing. Possible triggers. Reduced blood flow to the optic nerve or occipital lobe disrupts normal vision. Temporary vision loss could also result from amaurosis fugax, a condition linked to carotid artery blockages. Protect your eyesight. Schedule a checkup if vision changes persist, even if they seem minor. Address other risk factors like high blood pressure or diabetes to safeguard both your brain and eyes. Sign 12. High blood pressure. Chronic hypertension is often called the silent killer because it typically shows no symptoms but significantly increases your stroke risk. Consistently high readings can weaken arteries, making them more likely to rupture or clog. Long-term impact. High blood pressure accelerates the narrowing of arteries, restricting blood flow to the brain. Left untreated, it's a leading cause of both ischemic and hemorrhagic strokes. Prevention tips. Limit salt intake and focus on potassium-rich foods like bananas and spinach to naturally regulate blood pressure. Regularly monitor your levels and follow your doctor's recommendations for medication or lifestyle adjustments. Sign 13. Persistent fatigue. Fatigue that doesn't improve with rest is another red flag for stroke. Unlike regular tiredness, this fatigue is often described as overwhelming and unusual, affecting daily tasks and concentration. Connection to stroke. Fatigue may indicate reduced oxygen supply to the brain caused by partial artery blockages. It can also signal underlying conditions like anemia or cardiovascular disease, both of which raise stroke risk. Boost your energy levels. Incorporate light exercise and a nutrient-rich diet to improve overall energy and circulation. If fatigue persists, seek medical advice to rule out serious health concerns. Sign 14. Neurological symptoms. Balance and memory issues. Unexplained dizziness. Difficulty walking or sudden memory problems could point to a stroke. While these issues might seem minor, they can indicate reduced blood flow to critical brain areas. Why these symptoms matter. The cerebellum controls balance, and insufficient blood supply can impair its function. Memory problems may arise from damage to the hippocampus or other brain regions responsible for cognitive processing. What you should do. Don't dismiss balance issues or memory lapses as normal aging. Consult a neurologist for further evaluation, especially if these symptoms appear suddenly. Prevention is the best medicine. Now that you know the signs, it's equally important to understand how to reduce your risk. Here's a quick checklist for stroke prevention. Control blood pressure. Aim for readings below 120/80 millimeters of mercury. Adopt a heart-healthy diet. Include whole grains, lean proteins, and plenty of fruits and vegetables while minimizing processed foods and saturated fats. Exercise regularly. 150 minutes of moderate activity per week can make a significant difference. Quit smoking. Tobacco use damages blood vessels and accelerates plaque buildup. Limit alcohol. Excessive drinking raises blood pressure and increases stroke risk. Manage stress. Practice mindfulness, yoga, or other relaxation techniques to keep cortisol levels in check. Understanding these warning signs could save your life or someone else's. Don't wait for symptoms to escalate. Early intervention is key. If you or someone you know experiences any of these symptoms, act quickly and seek medical care. If you found this information helpful, don't forget to like, subscribe, and share this video. Together, we can spread awareness and help prevent strokes. See you in the next video. Stay informed and stay